He tested positive for COVID-19, spent more than a month in the ICU. Well, now 32-year-old Karna Gurung says he wants to warn others, especially those in the refugee community, to not let their guard down when it comes to the pandemic. KETV News Watch 7's Quinicia Fraser shares his story.
Karna won the coronavirus.
Karna Gurung was escorted out of Nebraska Medical Center and greeted by a wave of support May 31st.
I was so excited.
Gurung spent more than 40 days in the hospital after battling the coronavirus. 33 of those were in the ICU.
I came to know that I was in the very last stage of my life.
Gurung says despite taking all the recommended precautions, he still caught the virus.
I used masks, gloves, sanitizers.
The 32-year-old diabetic still doesn't know how exactly he was exposed.
I was really worried that I might die.
But says it started with a cough, which brought him to a clinic where he tested positive.
On the 10th day, I got very, very sick.
He was taken to Nebraska Medicine, where he says doctors used artificial lung technology called ECMO and remdesivir, a drug used to treat COVID-19.
After 33 days in ICU, in coma, I opened my eyes.
But his battle was far from over. Once he woke, Gurung says he was unable to move. He underwent therapy to walk, talk, and eat again.
It's my luck that I went to such a good hospital where they have a good treatment procedures.
But Gurung is no stranger to hardship. He fled his home country of Bhutan, seeking refuge in Nepal in the early 90s after civil protests.
We had to run away from the country to save our life.
In 2009, Gurung says the U.S. government resettled his family here in Omaha.
One of the things in terms of what's happening with COVID is that a lot of those families and a lot of our Asian refugees as a whole, beyond just Bhutanese, are disproportionately being impacted.
The president and CEO of Omaha's Charles Drew Health Center says they've seen an uptick with positive COVID-19 cases in Asian populations.
One of the things that we found is that we had a significant number of Asian Americans that were actually working in the meatpacking plant.
Kenny McMorris also says refugee families may be more susceptible to the pandemic because of their often tight-knit community.
1 or 2 bedroom apartments, multiple families. So it's very hard that in the event that they contract the virus to isolate and quarantine.
Before the coronavirus, Gurung says he spent much of his time advocating for other refugees. And he doesn't plan on stopping anytime soon.
I determined to work more for the community, more for the humanity, and more for the businesses and for quality life.
Gurung says that what he wants now is for people to continue to take this virus seriously. And he wants leaders to put both time and money into making sure a vaccine can be available. Reporting in Omaha, Quinicia Fraser, KETV News Watch 7.